So, good morning, everyone. My name is Shazia Khan, and today's learning outcome is learning outcome 2 that we'll be doing, which is to understand professional development in health and social care. Before I go into learning outcome 2, I just want to give you a summary of what we did in the last session, which was learning outcome 1 yesterday. And learning outcome 1, we looked at understanding career and progression opportunities in health and social care. We looked at the element of what personal development is, why it's so important within your own developing needs, and we looked at what professional development was. We also looked at, in learning outcome 1, is what CPD is, and also looked at reflective practice and the importance of reflective practice within any organisation, and why that's so good for you as an individual. We then went on to look at outlining careers within health and social care. We looked at things like care workers. We looked at direct care roles such as activity worker, care worker, personal assistant, rehabilitation worker. We then went on to look at management roles within health and social care, such as team leaders, managers, specialist coordinators. We also looked at other roles within social care support, things like housing officer, volunteer, employment advisor, welfare rights officer, and a trainer and assessor. We also looked at the regulated professional roles. Does anyone remember what any regulated professional roles are? Addy, do you remember any of the regulated roles? Why is it important to be registered with a regulatory body? And what actually jobs are regulated, are registered?
Basically, when you're talking about regulatory body, you're talking about CQC,
Mm,
and they are the one to regulate the activities of care home,
mm.
any home that
So,
is related
so
to health and social care.
yeah, so does
Yeah.
a nurse have to be registered?
Pardon?
Does a nurse have to be registered with a regulatory body?
Nurse,
Yes, they have to.
Yes.
yeah,
Yes,
they have to register because I think nurse have their own regulatory body that they will
yeah,
give them a pin so they'll be
yes.
able to work as a nurse in the country.
Because if you work within a regulatory body, that body is telling you how to work. Gifty, what were you gonna say?
Um, when he said no, I just
Yeah.
yes.
Yes, yeah.
Yeah.
Why do you think, Gifty, you have to be regulated?
Um, it ensures compliance and avoiding
Yes.
legal issues.
Yes, it's very important. As a doctor, you've got GMC, you've got to be registered, and it shows compliance and shows you're following their practices and procedures.
Yeah, and as well as protecting the public.
Yes,
Yeah.
yeah. We also in learning outcome 1, we looked at ancillary roles like having kitchen assistants, housekeepers, drivers. We then went on to look at progression within a chosen health and social care area. We looked at registered manager, social worker, nurse. And then we went on to look at analysing skills and knowledge required for a specific role, things like empathy, being empathetic, being a team player, dealing with pressure, communication skills, why these are so important, having strong management skills, having a positive attitude, being able to deal with criticism. And it's really important to have active listening skills because you have to be able to listen to the individual and understand what they're talking about and what they're going through. Conflict management, dealing with challenging behavior and working with disabilities. So that's looking at learning outcome 1. Now we're going on to learning outcome 2, which is to understand professional development in health and social care. The indicative content is to understand membership of professional bodies, standards and codes of practice, and continued professional development, why it's needed, why it's required, and why it's so important as well. So key terminology, we're looking at the element of identifying what is professional development in health and social care. So in health and social care, it's often referred to as CPD, and that's professional development, and that's really important within any organization, and it opens different doors for different people if you want to change your careers and things. Why do you think, Deborah, why do you think it's so important to have professional development within health and social care? Deborah, can you hear us?
Hello.
Yeah.
Sorry, I just joined back now.
Oh, it's okay. Why
Yeah,
do you think professional development is really important in health and social care?
it helps manage your own learning and
Yeah,
growth
yeah,
throughout your careers.
yeah. It's really important because you manage your own learning, but you also develop your learning and you make sure that you're continuously learning all the time.
Yeah.
Did anyone do the survey on the NHS website? No? Try to do that for the next session. It's really interesting. It's a 5-minute survey and it looks at what your career role is, and it's got 300 and what your results were from that. So have a look at that in the for the next session, okay? Because
Oh,
it's really interesting. It's a link on there. 2.1 is identify standards relating to professional development in health and social care. And there are different standards that you must meet, within health and social care. Professional standards are really important because it ensures that you are meeting the requirements of the public and you are meeting the standards, um, and that could be things like trying to make sure that you have expectations are put in place, that you are following legislation, you are following the law, you are following policies and procedures. Why is it so important to follow policy and procedure? Why do you think, Gifty, why do you think it's so important, to follow these policies and procedures?
It enhances the quality of the work
Yeah.
space. Yeah.
It also ensures that you are consistent, you are following the procedures, you are making sure that you are providing a high quality care and support that for that individual. So you are ensuring that you are competent with, your employers and things. And these standards have to be met because, as we go through, you'll see some of them are legal requirements.
Yeah.
You've got to meet this. And the PCA, which is the Professional Standards Authority, is an independent body, and they deal with, reviewing the work of 10 regulators of health and social care professions, and they have to be registered with them and they have to meet the standards. And it's important because the whole point of this is delivering a safe, ethical, and high quality care. You have to protect individuals' rights, don't you, Deborah? By meeting these standards.
Yeah.
It's really important in any organization within health and social care. You have to make sure the environment is safe and ethical for that person.
Yeah.
Okay. There are some laws that we need to look at in regards to making practices safe, okay, for the individual. The first one is the Care Standards Act 2000. Why is it so important, Catherine? Why is it so important to follow laws? Why do you think it's so important? Is Catherine on? Catherine?
Can you hear me?
Yeah, now I can, yeah. Why do you think it's so important to follow laws?
Yeah, I'm just joining at the moment, but I think it's important to follow
Yeah,
laws because the
yeah,
just to get things right, the
yes,
laws are set there just to guide you.
yeah.
So for
But
things
then
to
if
go
you,
according,
Catherine, if the laws are there to make sure you follow the laws, okay? If you don't follow them and get things wrong, are the consequences?
yes, of course, there are
Yes,
consequences
yeah,
if you break the law.
yeah. So it's really important within health and social care to identify that, we are following the legislation and we are following the laws to make sure that, you know, we're providing a good service. And the law is really, when we look at the Care Standards Act, it's a framework for care services in England. And the whole point of this act, it was to ensure that the care of vulnerable people, including those in children's homes, independent hospitals, care homes, are properly regulated. And the reason behind this is, you know, that a lot of care homes, there's been elements of abuse in care homes and other organizations, and they are not regulated properly. So, you know, this Care Standards Act is there to make sure that everything is regulated properly, everything is followed, and the legislation is followed, and establishes that, you know, the service that is provided is a good service for the individuals, and make sure that we ensure the vulnerability of the individuals. Under the Act, there's the element of things that they must follow. And the first one is the local authorities have regulated and meet some care needs as standards. Only agencies that provide personal need. And the Act established that councils register and regulate social workers. The Act introduced national minimal care standards. Why do you think, when we look at these acts, why do you think there's a need for the Care Act? Why do you think there was a need? Do you think there's been elements of issues around you know, social workers and the treatment of people? Why do you think this act was introduced in 2000? Do you think there were issues around social workers and how they are regulated and how they're not following standards and codes of practice and things like that? What do you think, Deborah?
I think since we are human beings, we are
Yeah.
bound to make mistakes.
Excellent. Yes.
Errors may bound to occur. So
Yeah.
once there is law and everybody is scared of the law.
Yes, 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 you're right, totally right. And I think it's been, Faustina, I think it was when there's been instances with children where they've been neglected by social workers. Baby P was a popular case. And a girl called Sky, where there was a lot of abuse by her family. And the social workers didn't actually, they were told that it was happening, but they didn't actually do anything. So in that instance, the law is secure. You're right, we are scared of the law, but it helps, doesn't it, Faustina? You know, it helps protect individuals. And just recently there was the case of social working neglect from a young girl called Salma Sharif. I don't know if you all heard of her case, where she was abused by her father and her stepmother. And the social workers were aware of this in the schools.
Yeah, I saw that on TV.
Yeah, it's very
Yeah.
sad. It was a very sad
Yeah.
case. So there are instances where the law needs to protect individuals. I understand that people are scared of it, but if it's the whole point of it is to protect vulnerable people, you know, sometimes it may go over and above, but you know, I don't know why. People tend to be scared of it, but then, you know, some of these organizations should regulate codes of practice and make sure they are providing that service. What do you think of, I know Faustina said people are scared of it, but Catherine, what do you think of the law? Do you think it's a good thing to have laws in place?
Yeah, I think it's a very good thing for laws to be in place.
Why do you think? Do you think they protect people?
Yes, it protects people, especially some people are vulnerable,
Yeah.
some persons, yeah. So if laws
But
are not in place,
it's not just protecting them, it's protecting you. For example, if you have issues around employment law and things like that, you'll have laws to protect you, you know, for your
that's
working conditions and things like that. So the next one we're looking at is called the Domiciliary Care Regulations. And this is another act that was introduced as a framework for regulating domiciliary care agencies, which are defined as organizations that provide personal care for service users in their house. And these came into force to ensure that they provide safety, dignity, and well-being of service users receiving personal care. And the regulations emphasize the importance of this and focus on promoting an independent service user, respecting their privacy. So, this is a law that was supported by CQC, compliance under the Care Act, and it was there to help people within the home care. Then we have another really important law, which is called HASWA, which is Health and Safety at Work Act. And this is a primary UK legislation, and it sets the foundation for health and safety and at work, and also welfare. And it places a duty on your employers to ensure that you're as far reasonable and practical, the health and safety of their employees, which are you, may not be affected, others who may be affected. So they are protecting you. And it's looking at workplaces, it's looking at the employers have a duty to provide you a safe workplace. And what could be an unsafe workplace? Give me an example of something that may not be safe in your workplace. Faustina, what do you think that can't be safe in your workplace?
I'm not clear with your question, please.
Okay, so if you go to your workplace and something is there and it is unsafe, it's not following the health and safety, give me an example of something that could be unsafe.
Example is asking me to lift something which is heavier than my weight.
Excellent, excellent. Something to lift something that's heavier than your weight.
So I have to
Excellent.
go on risk assessment.
Yes, risk assessment. Yeah. What about if
Physical
need?
abuse.
Sorry?
Physical abuse, like
Yeah,
hitting,
physical abuse, yeah.
pushing.
But more of a health and safety issues. What if you've gone to work and there's needles around everywhere? Do you think
Yeah,
that's a health and safety issue?
that one too.
Yeah.
It's a possible
Yeah.
issue.
So, things like health and safety would be, conducting risk assessments. You need to make sure, like Faustina said, you can't make her pick something up that's heavier than her. You're not providing a safe environment, are you? Making sure, that you're complying with the law, but you're also making everything safe for that individual to work around. There may be, liquids that shouldn't be there, and the person's working around that. So you should make sure you promote this culture of health and safety within the workplace, but also, you have the employers have a legal obligation to you to make sure that the workplace is safe. And it's, any sort of dangerous substances that are around, any sort of spillages or anything, that everything is in place, because they have to comply with it. Because if they don't, the health and safety at work of the officer will come in and he will shut the place down. It's really, really, it's one of the things that is quite harsh, because the health and safety officers will shut you down straight away. If they feel that there's not enough health and safety at work, they will shut the place down. And they have that authority to do that. The next one is manual handling operations, and that was the example that Faustina's just given, which was quite good. And the manual handling is to do with preventing any sort of injuries during manual handling, because just example, if you're working in health and social care, you've got hoists, hoists that people pick up. What if they can't pick the person up? What if they've got back problems? This is something that they need to risk assess, but make sure that you avoid doing these things. Lifting and training is given, how you would bend your back, how you would pick things up. Anything that was hazardous. Risk factors could be the weight of something, the size of something. It could be, the fact that it may be things like floor conditions or the lighting, which may have an impact on it. So these have to be all taken into consideration when you're looking at elements of that. Then you've got the next one, which is management of health and safety at work regulations. And this is designed to ensure that employers manage health and safety effectively. and they look at the Health and Safety at Work Act 1974, which we just referred to as well, and make sure employers must assess risk to employees and anyone affected by the work activities, identifying any sort of hazards, making sure that there's health and safety advice there, making sure that instructions and training is put in place, making sure that employers have made appropriate arrangements for any sort of health and safety, and making sure that, you know, there's records of everything that's kept. Because if anything happens, why is it important to have records in place? Why do you think it's so important to have records in place if anything happens?
For references.
Yeah.
And it protects you too.
Yes. Yeah. Protect you as an organization as well, doesn't
Yeah.
it? So the next act we're going to look at is which is quite an important act as well as the other ones, but this is the Mental Capacity Act. And this act obviously aims you to protect people who have mental capacity, okay? It protects vulnerable people aged 16 and over who lack the capacity to make their own decision about their care and treatment. So, you know, it provides a legal framework for making decisions on behalf of people who lack capacity. So anyone that lack capacity is anyone that has any sort of mental health issues. It could be people with dementia that lack capacity, you know, learning disabilities, anyone with any sort of brain injuries, mental health or strokes. You know, it could cover things like, you know, making decisions about their welfare, financial decisions. You know, so it's really important, you know, when you look at elements of that this person is able to make their own decision, but you are not, you know, they're not under duress. They're being forced to make this decision. So this person must have the mental capacity, but if they don't, they are vulnerable and they are protected. Codes of practice are detailed guidelines. Okay, these are guidelines and guidance on how to comply with legal obligations and promoting good practices. And these are things like, you know, if you have a legal structure in place, they are like guidance documents. Okay, and they are there often to protect and advise people. Okay, so they're there for protection and advising others in regards to that. Some codes are voluntary. Some codes are practice that you must follow, things like health and safety and reporting any sort of injuries that you must follow. And some are that you must comply with where you work in the organization. And you know, having codes of practice related it's there to ensure any sort of transparency and also meeting legal obligations as well. 6 codes of practice within the health and social care profession. Are some examples here. So as a social worker, you know, you protect the rights and promote your interests of service users. As a social worker, you must strive to establish and maintain the trust. As a social worker, you must promote the independence. As a social worker, you must respect other service users' elements, and as a social care worker, you must ensure public trust and confidence. You know, there's care, compassion, competence, communication, and courage and commitment, and they are the main 6 framework of ethical and effective care in both health and social care, ensuring that any sort of individuals, you know, receive the best possible support and care that they need. So, you know, you have to follow these to make sure that, you know, it is competent. And having codes of practice is important because it ensures that you have a safe and ethical environment for any sort of service users, and organizations have to abide by them. You know, if you're not listening to your employers, then there's no point having codes of practice in place. The next one is National Occupational Standards in Health and Social Care. Has anyone got any questions before we carry on? Okay. So the National Occupational Standards in Health and Social Care is a benchmark statement that describes the skills, knowledge and understanding required for a specific role or task. They provide the framework for training, ensuring workers meet high standards and delivered effectively. Why do you think it's so important within health and social care to have sufficient amount of training? Why do you think it's really good that you have the training? Why do you think you need to have sufficient amount of training, especially in health and social care? Faustina, why do you think it's important to be trained?
Yeah,
If,
this is
if you are not trained, you will surely be having problems. You
Okay.
cannot,
So
because if you don't know how to use the hoist, you may end up killing somebody or
yes, yeah,
hurting
you're
somebody,
totally
and you
right.
hurting your own self.
Yes,
If you don't know how to even clean someone, you may end up injuring the person or bruising the person.
yeah,
Even medication, you may give the wrong dose to someone,
yeah,
give somebody's own to another person. So it's
yeah.
a whole lot of complications created,
It is so
and you find
important.
yourself in
You're right,
trouble.
Faustina, 100% right. It's so important. You might hurt people. You might, you might hurt yourself. So it's really important to be trained, especially in health and social care. Everything is changing all the time. So you need to make sure you're adapting to that change. Tolu, did you want to say something?
Yeah, I wanted to say something. This is Tolu.
Yeah.
I just joined in. Good
Okay,
afternoon,
it's okay.
everyone.
Yeah.
Yeah. So, being trained is very important because healthcare sector has a lot of ethic, has a lot of things that we need to know
Yeah.
professionally as a professional. So you can't just go to the health sector and use the hoist when you're not
Yeah.
trained. You can't
Yeah.
go to the health sector and want to fill on radar when you're not
Yeah.
trained. So
Yeah.
you need to be fully trained and go to the field and perform wonderfully well.
Yeah. And in health and social care, Tolu, everything changes all the time. New
Yeah.
laws are brought in, new, equipment is brought in, so you need to be trained.
Yeah, of course. Yes.
So we're looking at
Yes,
2.2,
the
assess the
quality of
need for
care.
continued professional development. And Tolu's just said, we must keep up to date with current legislation. We must keep up to date with practices. We must make sure that we are competent and we are ensuring that we maintain this competence, adapt to evolving practices because everything's changing all the time, and make sure that we are following the regulation, the laws, the policies and best practices, because we make sure that we are improving patient outcomes and we have a resilient workforce. We have to follow professional bodies because CPD makes us stay up to date and provide an effective and safe care. So we need to make sure that we can provide this lifelong learning for all the time, enhancing our professional and personal growth and making sure we are meeting the needs of the service users. Examples of CPD. So CPD, different examples of CPD are things like that's continued professional development. Things like, training, reading, attending workshops, participating in professional networking, undertaking research, making sure we've got mandatory training in place, college or university level education, shadowing, mentoring, peer review. These are elements that, that you could be an example of CPD within your own workplace. So you could be reading journals, you could be reading articles, and you could be reading books to keep you up to date. You could be engaging in work-based learning, reflecting, mentoring, being participating in discussions, volunteering. These can be parts of, getting shadowing maybe. These are all parts and examples of CPD that can be provided to you. CPD in health and social care. And again, it's really, really important. Within health and social care, CPD is really important because it allows you to learn all the time. Gifty, why do you think CPD is so important within health and social care?
It's promotes the well-being,
Okay.
yeah, of
Okay.
the individuals.
Yeah.
CP,
And sorry, what was that, Gifty?
it's Tolu.
Tolu.
Yeah.
Why do you think CPD is so important within health and social care?
Yeah, as you told us yesterday, and we discussed yesterday that CPD is it makes us refresh our brain,
Yes.
makes
Yeah.
us refresh our memory about what's
Yes.
the course and what training is all about. Because as you said before, that laws changes every day. We
Yeah.
have a lot of laws that come out,
Yeah.
policy that come out, ethics that
Yeah.
come out. Oh, this is not
Yeah.
what we are using today. This kind of oils we are using tomorrow. So we need to be
Yes.
updated. Yeah, we need to be updated about the healthcare settings.
Yeah, it's all about improving the quality of care that you provide and
Yeah.
ensuring that, you are updated with any sort of latest advancements, any sort of regulations, best practices. The whole point of it, why it's so important, is it provides care for individuals. It provides competence, and for you as you're able to trust your own self as well, that you're able to do your job. It could be, for example, if you're a nurse and you attend a conference, that could be CPD, or a doctor doing an online course, that could be part of CPD. Or if you're a healthcare professional, you're doing some reading and research around maybe dementia, cancer, that is part of CPD. So it's really, really important. The next element is looking at the benefits of CPD, why it's so important within any organization, why there's a need for CPD, and looking at the element of there's different benefits of it. It enhances your skills. You are CPD provides you the opportunity to learn new things. What else could it be?
You
Alice?
even become confident
Yes,
in your
confidence.
services.
Excellent. Confidence is a good one.
It
Alice, have you got
And
anything,
the
Alice?
person trust in you.
it
Sorry?
enhance the quality of care.
Yes, quality of care.
Then the
Anyone
patients
else?
even trust you when
Yeah,
you work in. Yeah, they
yes,
trust you.
yeah. Catherine, have you got anything? Alice, Addy? Why do you think what are the benefits?
It's increase your skill, you
Yes,
know.
skills. Skills is a
Yes,
big one.
it's increase your skill. We have a lot of skill, reliability, adaptability, patience, calmness, and all that. So
Yeah,
it increases it more on how you can use it on the field, so that even the the resident we are taking care of can confide in you. When they are talking to you, they'll feel safety. Yeah, they'll feel
yeah.
safety when they're talking to you.
What about like things like, networking? It helps you, advance your career.
Yeah,
If you
career
have better
progression and all that.
skills, you can go for
Yeah,
more promotions. You've got more options, more
yeah.
opportunities. Also, it enhances your job security.
Yeah,
It,
continuous
your profession
improvement.
increases your confidence, like Faustina said. It improves your skills. It adapts to different challenges. It also is it keeps you ahead of any sort of trends or any changes in the law, and it improves the whole point of it is improves quality of service, and it keeps you up
Engagement
to,
and motivation.
yes, motivates you. If you think you have a skill, it motivates you to apply for different jobs. If you want to go a little bit higher or apply for a different position, it motivates you. CPD is there to help you, and it motivates you, to go for, different jobs at a different level. When I've done a course, I feel so, when I've passed the course, I feel so happy that I can, if I need to look at another career, I could kind of go for it because I know that I'm there, it's increased my skills, it's made me confident, it's made me confident to apply for a better position. So, it is really good for people to do CPD. The next one is 2M1, so that's a merit one. Assess the continuous professional development requirements for a chosen health and social care career. So, they are different personal development for different careers. And the whole point of it is to make sure that you are up to date again, that you provide best practice. You make sure that, you're ultimately better in your field, and it's there to maintain your competence, making sure that you're competent in that area. So it could be any sort of training, and and the whole point is when you do a training, you keep up to date with everything. you know um Social Work England is there to help you in regards to any sort of continued professional development, and it's a specialist body taking a new approach in social workers to provide them, with a set of standards to register quality assurances and assures education and investigates any complaints. But the whole point is that they are making sure, because of sometimes there's been issues with social workers, they have, there have been issues. They have to make sure they have got training all the time. Why do you think it's so important as a social worker, to have training all the time and make sure you are current with everything? Why do you think it's so important? Do you think it's a really important job, social worker?
Social worker, we prefer solutions to challenges that individual, group of or community are going through. So learning is just too important. We need to learn every day.
Yeah.
You need to be updated so that when you get to the field, you know what you are doing. You're not
Yes.
passing the wrong side.
Yeah.
You can
And also,
understand. Yeah.
you need to protect, if you're a social worker, you need to protect individuals, you need to protect families,
Yeah.
you need to protect children, you need to protect communities.
Mm.
And if you're not doing that properly, with all these cases, examples of baby P, the girl called Sky, the young 5-year-old, then the new case, which was quite recent, the girl of Salma Sharif, who got abused by her father and stepmother. Social workers in that instance were not, dealing with issues properly because it was put aside. Now, if you're not fully trained and you let things, slip under the carpet, you're not providing that service, are you, for them people? You're not protecting them, and that's why the law has become more stricter now, because, the social workers, the whole point of a social worker is to protect and enhance well-being and help meet basic needs. And if they're not doing that properly, then it's going to be difficult.
Yeah.
What do you think about
yeah.
that?
Yeah.
Yes.
Yes, you're right.
So it's really important to protect these individuals all the time. So the next one is, what counts as CPD for health and social care settings? So what counts as CPD is elements of it's things like training, workshops. Like we mentioned earlier, training and workshops are so important when it comes to CPD, and why there's a need to have these in place. It's all there to, provide this kind of professional body and make sure that, you are on top of things. And it's so important that you are shadowing people if it comes to doing any sort of care or anything. So you have to keep up to date with all that. So we've now finished learning outcome 1. I'll just give you an overview of what we've gone through today. So a summary of today's session: we've looked at understanding professional development in health and social care. We've looked at what professional development is. We also looked at the Professional Standards Authority for Health and Social Care. And we looked at the legislation, the law in practice, which are things like the Care Standards Act, the Health and Safety Act, the Domiciliary Act. We looked at manual handling, management of health and safety at work. We looked at Mental Capacity Act and the importance of that in regards to it. We also looked at codes of practice, why they are so important in health and social care. And we looked at the 6 main codes of practice in health and social care. We went on to look at national occupational standards, and we looked at assessing the need for continued professional development in health and social care. We also went on to look at different examples of CPD, including things like distance learning, webinars, mandatory training. Also looked at taking part in clinical audits. We also looked at why shadowing is so important. We looked at CPD in health and social care, why it's so needed, and the purpose of CPD to enhance quality and make sure that, everyone receives a quality care, because that's so important in regards to CPD. We also looked at the benefits of CPD, things like making sure that everyone, is getting skills out of doing the training, making sure that it increases your, makes you better for applying for new jobs, different specialisms to improve your specialism area. Make sure that, you have the confidence to, apply for promotions and things like that. And also, it promotes a healthy learning environment, making sure that the quality of patient care and depth of healthcare professionals grows over time. So it's really, really important. We looked at the continued professional development requirements, and we also looked at what counts as CPD in health and social care and why that is so important. So it could be activities, it could be observations, it could be shadowing, it could be making sure that you are attending like care demon, and training opportunities. Make sure you grasp all the training opportunities you get, because it's so easy to get that training opportunities. And make sure you are up to date. Make sure you are, you have research in place that helps you keep up to date. Because if you don't keep up to date, you're going to fall back. If you don't know how to, if you don't know how to use a hoist, don't use it until you've got your training. These kind of things are important because you could hurt yourself, like Faustina said, or you could hurt the patient. So you need to keep on top of things in regards to that. So these are the references we've used for today's session. Anybody got any questions before we finish the session? Okay, these are some of the preliminary. Go on to Moodle. These recorded lectures will all be on Moodle. Additional reading on Moodle is Improving Continued Professional Development, which is on Moodle. National Occupational Standards for Health and Social Care, again, which is on Moodle. Principles of CPD and Lifelong Learning, which is on Moodle for you to have a look at. And there's other additional reading there for you to look at. So all these sessions, so yesterday's session, Learning Outcome 1, Learning Outcome 2 has all recorded and will be put on Moodle. Any questions you have, email learnerwork@ukvarsity.co.uk. And then the submission of the assignment, when it comes to it, is done on learnerwork@ukvarsity.co.uk. Also, what I'd like to say is go on to some of these links here. You could go onto them and have a look and read around there. But a lot of the additional reading is available on Moodle for you. Has anyone got any questions? No questions? So thank you for attending today's session, and I will see you all in the next session, which is next week on Saturday at 11 o'clock, which will be Learning Outcome 3, which is looking at elements of understanding how reflective practice supports personal and professional development. Thank you for attending today's session. If you have no questions, it's the end of the session.
I'm trying to ask
Sorry?
I want to ask a question.
Yeah.
Okay.
Yeah, I want to ask, how do we do, our assignments? Where do we get it from?
It's
You
on
know, I am
Moodle.
new.
All the assignment brief, everything is on Moodle for you.
Okay.
All the module specification, everything is on Moodle for you, okay?
Okay.
Okay. Thank you everyone for attending.
Thank
Thank
you.
you.
Thank you. I will see you
Bye.
next week. Have a nice week, everyone.
Bye.
Bye.
Bye. Bye.
Bye, everyone.
Bye.